Good morning. Today's talk is once again returning to the topic of age, anti-Müllerian hormone concentration, and oocyte yield in the context of planned oocyte cryopreservation. And without being a spoiler, it's all about the number of eggs. So I'd like to review 4 papers. The first 2 on the left is looking at AMH levels and the number of eggs you might expect, with the aim of being able to provide counselling to couples about their expectations of success. And the other 2 are looking at outcomes from oocyte cryopreservation based on the number of eggs collected and age. So like always, as a welcome and disclaimer, my name's James Danger. I'm an embryologist with more than 50 years experience. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice you will receive. I'm just starting out, but if you would like to promote your company or clinical product, then consider this site. The aim is to make the IVF client a better informed IVF client. I encourage you to click subscribe or become a sponsor and make a donation through my GoFundMe page. But whatever you do, please leave a comment. And if you like it, click like. Okay. So let's look at the first 2 papers. One is the publication. The second one is an editorial of it. It's basically looking at, in the real life data, what is the relationship between age, anti-Müllerian hormone, AMH level, and the number of oocytes. And once again, excuse me, the AMH is not really about ovarian reserve, even though it is related. It's not necessarily a true relationship of ovarian reserve. The AMH is about predicting the number of oocytes you will be able to recover at egg collection in a stimulated cycle. So here's the data I've taken. I summarised the tables from the paper, but basically you can see that for women under 35, 36, an AMH level of 2 or above will produce somewhere about 10 to 12 to 20, 25 oocytes. So anything above AMH of 2 for younger women would seem to be a good marker. But you do get women, quite a few women whose AMH is less than 2, and there's still quite a few whose AMH is less than 1. Even with those numbers, you can still get 8 or 9, 10 oocytes, which is 8K. So just because they have a really low AMH doesn't mean you're not going to get eggs. If you look at the group, what I call middle-aged reproductive, I'll probably get into trouble over that. But you can basically see that, once again, the level of 2 AMH or above gives you a reasonable number of oocytes, but very poor quality, very low levels of AMH, less than 1 or less than 0.5, still gives you a reasonable number of oocytes. But this age group, an AMH less than 5 is down in the fairly poor recovery area. 2 to 3 oocytes is really not a likelihood of success. And if you are unfortunately over 40, you can see even with an AMH of greater than 5, you're still getting quite a few oocytes, but these are quite rare. The lower levels start to rise somewhere to around about 1. And this middle group, 8, 9, 10 eggs is okay, but you're not going to get the maximum out yield for it. So looking at the summary of that data, the authors who did the review make a point that the ASRM believe that elective oocyte cryopreservation is a safe and ethical means of preserving reproductive autonomy, but they make the point that only 11% of people that have eggs they're frozen return to use their stored eggs, and the results do reveal a huge variation in AMH between individuals at the same age, but also confirming the expected decline in AMH with increasing age. So these tables, the reviewers suggest, provide a precise answer to patients' most common question: how many eggs should I expect to get to retrieve based on my age and ovarian reserve? But there is another point they need to make out, is that it's limited by the AMH assay, and there is some variation between assays, and they will give you different values. But the results do provide there's an age-specific AMH reference ranges and demonstrate a clear relationship between higher AMH levels and greater mature oocyte yields. They also make the point that, once again, it's limited by the assay for AMH. The authors note that the measurements were determined by enzyme-linked immunoabsorbent assays or electrochemiluminescent methods, and they will vary. So you need to ask your doctor what method you're using, and as the results, are they relevant or not? I'd just like to change focus a little bit and look at two reviews looking at the systematic review of return rates and pregnancy rates after oocyte cryopreservation for planned fertility. The first one screened about 1,500 references. They found about 27 studies, including 13,000 patients and 18,000 odd egg retrievals. And the follow-up range was for roughly 7 years, but ranged from 4 to 19 years follow-up. That's a fair time. And they did report that of the 17,500 egg retrievals in the 1727 studies, most individuals underwent a single cryopreservation cycle. Hardly anyone had more than one. And they also noted that overall only about 10-11% of people returned to thaw their eggs, with an aggregate survival rate of around about 80%. The implantation rate was 40% right across the board per embryo transferred, and the clinical pregnancy rate was about 35%. So this data should be basically saying individuals should be counselled regarding, one, the low return rate for following cryopreservation, and the very poor pregnancy rates that flow from it. So couples need to recognise when they're having the eggs frozen that only about 1 in 10 couples will actually return to have it used. And at that point in time, they need to start thinking preemptively about what they will do with the eggs if they don't use them. The second summary was published last year in Human Reproduction Update. They also reviewed 10 studies of 8,500 women, and once again had the same data that might well be the same studies they're reviewing. 11% of people returned, survival rate of roughly 80%, fertilization rate of those surviving eggs of 72%. That's roughly about 60% of all eggs frozen will produce an embryo, and overall about 28% live birth rate. But as they pointed out here, this is age dependent, and I'll show you some data in a minute. So basically, they looked at roughly the 8,500 women being frozen. The mean age of these studies were 37.5. So they're not young women having their eggs frozen. 9% were over 40, and only 20% were under 35. So most of the women having their eggs frozen for cryopreservation were in their late 30s. On average, they recovered 9 eggs, and have it roughly, of those, 87% of those were vitrified. So it means about 12% of eggs collected were not mature. And there wasn't a lot of discussion here, but some eggs had their eggs tested by PGTA. Looking at the results from thawing, as I said, the number of women, 1,500 women returned, about 11%. The mean age of thawing was almost 42. That was roughly 4 years from freezing to thawing. So that would be women in their late 30s returning in the early 40s to have the eggs thawed and transferred. And that, of course, has some implications for the data looking at pregnancy rates per age, that a lot of women in their 40s will actually have their embryos transferred, but they came from 38-year-old oocytes. 3/4 had a partner, and the survival rate, once again, was 78%. Fertilization rate, 72% of the eggs injected. So it's roughly about 60% of all the eggs frozen will be made into embryos, and right across the board, a 28% live birth rate. But I just wanted to show a couple of forest plots. One is looking at the average survival rate, and except for 1 or 2 studies, there is a reasonably good relationship between all the different studies of roughly around about 80% of all eggs will survive. So that means there's about 20% of all eggs frozen by vitrification do not survive. And these are the ones that probably they're mature, but overall across the board, the fertilization rate was remaining 72%, so I'm just repeating myself. But if you go back and look at the cumulative pregnancy rate, that is when all the embryos all the oocytes have been thawed, made into embryos, some PGTA tested, then refrozen and put back one embryo at a time. So there's lots of transfers. That's why it's called a cumulative pregnancy rate per cycle. In this study, they report on 450 odd live births, producing a live birth rate of 28% and 30% per transfer. So there's a few cases there where embryos were thawed and there was no transfer. But if you go back and look at the impact of age, and once again, there's only 9 or 10% of women in this group are under 35, and the results are dominated by one study by Kobo. But the majority here, the pregnancy rates, the cumulative live birth rate for people under 35 was 52%. So if you're under 35 and you have some eggs frozen, you have roughly about 1 chance in 2 of having a baby when those embryos have been thawed, fertilized, tested, refrozen, and put back one at a time. It's a little bit less, but still quite effective for women 36 to 39. Here, the pregnancy rate was 34%, 1 in 3. Once again, this data is also dominated by one larger study. And for women over 40, this is the age when the eggs have been frozen. You can see there is still, it's actually a fairly good one, dominated by one large study, but the cumulative live birth rate can vary from maybe 10% to just under around about 20%, and one study here at 22%. So the advice you would have to give a couple, if you're having eggs frozen and when your woman is over 40 and they return to have them thawed and transferred, they still have about a 1 chance in 5 of having a baby. I think those odds are still pretty good. But just want to go back and look at another pregnancy that came out just recently, human reproduction, looking at the effective egg numbers on cumulative live birth rate. So this isn't for oocyte donation, this is just right across the board, and pooling of 4 large randomized control studies. So in this group of 1,800 patients, the average age right across the board is around about 5 or 6 or 7 eggs. So when you're talking about 20, 30 eggs, not very many couples in IVF produce that many oocytes. So even though you may like to say if you have lots of eggs, you can do really well, in reality, most women will only produce somewhere between around about 8, 10, 12 eggs. But if you go back and look at the cumulative live birth rate, that is, go and look at the chance of pregnancy when all those eggs have been fertilized, cultured at day 5, tested by PGTA, vitrified, thawed, transferred one at a time. When all those embryos have been transferred, their cumulative pregnancy rate, this is a live birth rate, not pregnancy rate, this is a live birth rate. You can see here with the 1 or 2 eggs, it's not very encouraging. But once you get to 3 or 4 eggs, there is a cumulative chance, of 1 chance in 3 of you having a baby if you have 3 or 4 or 5 eggs. 1 in 3 having a baby is actually fairly good odds per pickup. You can see why in the UK they often encourage people to have up to 3 cycles. But what's interesting is there is just a slow, steady increase in the live birth rate as you recover more eggs up until around about 2025 when it peaks. And then over 25, 26, 30 or so, the live birth rate starts to fall. It doesn't fall very much, but it's starting to tell you that when you're into these larger numbers of eggs, they're PCO cases, and the overall quality is diminished even amongst the good healthy follicles. What I think is really important is there's this big swag of cases, 20 to 30 eggs per case, but no matter how many embryos you put back, the cumulative chance of pregnancy is round about 65%. Even though some studies have reported pregnancy rates of 100%, that's just, I think, better luck. But so we should everyone should recognise that in IVF, when the very best we can do when we make lots of embryos, do lots of transfers over and over again, only about 65% of women will fall pregnant. Now, whether that's a client thing or some other aspect of technology, I don't know. So just to go back and look at eggs, how many eggs do you actually need? There are 3 studies that, this is from this review in 2024. 3 studies looked at the association between a number of oocytes and live birth. In one, they found that for women over the age of 35, the live birth rate was 25% for those who preserved 10 eggs or less, but rose to 50% if those who had managed to cryopreserve 20. Another study stratified by the number of thawed oocytes Those who had 10 thawed oocytes or less had a significantly lower birth rate than those who had more, 24% compared to 58%. So if you have 20 mature oocytes that have survived thawing, so that's roughly around about 25 to 30 eggs, then you roughly then your chance of having a baby is more than 1 in 2. Another study looked at the live birth rate. They also said that people that felt pregnant had retrieved more oocytes, 19, than the group that did not. So what can you conclude? You can conclude that planned oocyte cryopreservation is a feasible option for women seeking improved chances of giving birth at an advanced reproductive age. However, success rates are limited, especially for women over 40 when undergoing planned oocyte cryopreservation. Delivery rates are significantly higher for those who are under 35, emphasising the importance of considering cryopreservation at an earlier age for better outcomes. But it's important to note that even the very, very best that IVF can offer is when all those eggs have been fertilised, transferred, when they've all been used, the chance of pregnancy is only about 1 in 2, maybe a tad higher if you're under 35. And at the moment, there is no reason there's no explanation as to why that is the case. But the important thing is couples should be counselled before they have their egg collection that their ultimate chance of pregnancy per egg collection is if you're under 35, around just over 60%. I hope this information is of value to you. I understand IVF is a personal journey that involves the actions of many different techniques and many people, and it helped to understand all the aspects of that journey. I hope this information has been of value. If you'd like more information, please, if you like the information I provided, tell everyone about it and click I liked. Okay, thank you.